Question 1. Which agency is responsible for establishing and enforcing regulations that protect workers from occupationally caused illnesses and injuries? A. FDA. B. EPA. C. OSHA. D. AAMI. Answer: C. OSHA. This question tests your knowledge of the Occupational Safety and Health Administration, OSHA, and its primary role in healthcare. The keyword worker protection is a strong clue, as OSHA's core mission is to ensure safe and healthy working conditions for employees, intervening even when specific regulations are absent. For example, OSHA mandates the use of personal protective equipment, PPE, in the Central Service Decontamination Area to shield technicians from hazardous materials. Remembering that OSHA focuses specifically on the safety and health of the worker helps distinguish it from other regulatory bodies. Question 2. What is the primary purpose of personal protective equipment, PPE, in the Central Service Decontamination Area? A. To make staff uniforms look professional. B. To prevent the spread of odors. C. To create a barrier against potential biological and chemical hazards. D. To keep the work area tidy. Answer: C. To create a barrier against potential biological and chemical hazards. This question addresses the fundamental purpose of PPE, a critical concept in infection prevention. The keywords decontamination area and hazards highlight the need for protection from bloodborne pathogens and chemicals commonly found there. PPE, such as gowns, gloves, masks, and eye protection, forms a physical barrier that prevents contaminants from reaching the healthcare worker's skin, mucous membranes, or clothing. For instance, fluid-resistant gowns stop splashes from soaking through, protecting the wearer from contaminated liquids during instrument cleaning. Always remember that PPE is your primary defense against workplace dangers in central service. Question 3. What is the correct dilution ratio for household bleach, sodium hypochlorite, used as an effective disinfectant in sterile processing, unless otherwise specified by the manufacturer or facility policy? A. 1:1. B. 1:5. C. 1:10. D. 1:100. Answer: C. 1:10. This question tests your knowledge of common disinfectant dilutions, a practical application of infection control principles. The keyword dilution ratio for household bleach points to a standardized concentration used for effective disinfection. A 1:10 dilution means 1 part bleach to 10 parts water, providing sufficient antimicrobial activity without being excessively corrosive to surfaces, making it a widely accepted standard for environmental disinfection in many healthcare settings. Always confirm your facility's specific policies and the manufacturer's instructions for any chemical, but 1:10 is a key ratio to recall for general bleach disinfection. Question 4. Which classification of medical devices, such as heart valves and pacemakers, poses the highest risk to patients and requires pre-market approval, PMA, from the FDA before being marketed? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer: C. Class 3. This question focuses on the FDA's medical device classification system, a key aspect of regulatory compliance. The mention of heart valves and pacemakers and highest risk are crucial keywords that identify these as devices that are life-sustaining or implanted, thus requiring the most stringent regulatory oversight. Class 3 devices undergo rigorous pre-market approval processes, including clinical data submission, to ensure their safety and effectiveness before they can be sold. Understanding these classifications helps central service technicians recognize the regulatory scrutiny and importance of the devices they handle. Question 5. The primary mission of the Association for the Advancement of Medical Instrumentation, AAMI, is to: A. Enforce legal regulations on medical devices. B. Provide voluntary guidelines and recommended practices for medical instrumentation. C. Develop and market new medical technologies. D. Control the pricing of medical devices. Answer: B. Provide voluntary guidelines and recommended practices for medical instrumentation. This question assesses your understanding of AAMI's role in the central service profession. The keyword primary mission combined with AAMI should direct you to their function as a leading source of guidance, not enforcement. AAMI develops widely respected voluntary standards and recommended practices for the use, care, and processing of medical devices, which healthcare facilities often adopt to promote patient safety and quality. For example, AAMI publishes detailed technical information reports, TIRs, on steam sterilization and water quality, serving as essential resources for sterile processing departments. Remember, AAMI recommends best practices, while government agencies regulate. Question 6. What is the initial and most crucial step in the decontamination process for soiled instruments? A. Sterilization. B. Disinfection. C. Cleaning. D. Drying. Answer: C. Cleaning. This question tests your foundational understanding of the decontamination cycle. The keywords initial and most crucial step emphasize the importance of physically removing soil. Cleaning is the thorough removal of all visible and invisible soil, debris, and microorganisms from an item, usually through manual scrubbing or mechanical washing, before any disinfection or sterilization can occur. Without effective cleaning, residual organic material can shield microorganisms, making subsequent disinfection or sterilization processes ineffective. Think of it this way: you can't truly sterilize something that isn't clean first, just like you wouldn't try to wash a dirty dish without removing the food stuck to it. Question 7. According to OSHA's Hazard Communication Standard, what critical information must a chemical safety data sheet, SDS, include? A. The chemical's market price and preferred vendor. B. Information on handling, first aid measures, and hazard identification. C. The history of the chemical's invention. D. Employee testimonials about the chemical. Answer: B. Information on handling, first aid measures, and hazard identification. This question assesses your familiarity with OSHA's Hazard Communication Standard and the importance of safety data sheets, SDSs. The keyword must include and the context of chemical safety data sheet point to essential safety information. An SDS provides comprehensive details about a chemical, including its properties, physical and health hazards, safe handling procedures, emergency control measures, and first aid instructions, ensuring workers know how to protect themselves and respond to exposures. For example, if a corrosive disinfectant splashes on your skin, the SDS will tell you immediately to flush with water for a specified duration. Always refer to the SDS for safe chemical handling and emergency protocols. Question 8. Which term defines a written law adopted by a legislative body, such as a city, county, state, or federal government? A. Voluntary standard. B. Best practice. C. Regulation. D. Statute. Answer: D. Statute. This question defines a fundamental legal term relevant to healthcare compliance. The keywords written law and adopted by a legislative body clearly describe a statute. A statute is a formal written law created by a legislative branch of government, setting forth rules that have the full force of law, and noncompliance can lead to penalties. For example, the Safe Medical Devices Act of 1990 is a federal statute that requires healthcare facilities to report device malfunctions. Knowing the difference between a statute, which is a formal law, and a voluntary standard, which is a guideline, is crucial for understanding compliance. Question 9. What action is crucial during the manual cleaning of hinged instruments to ensure proper decontamination? A. Keeping them tightly closed to maintain sterility. B. Opening and closing them underwater to expose all surfaces. C. Cleaning them with abrasive pads. D. Placing them in an ultrasonic cleaner while closed. Answer: B. Opening and closing them underwater to expose all surfaces. This question addresses a key best practice in the manual cleaning of instruments. The keyword hinged instruments highlights their unique design feature, which can trap debris. Opening and closing hinged instruments underwater allows cleaning solution and friction to reach all crevices, box locks, and serrations, effectively removing bioburden that would otherwise be protected from cleaning agents. Failing to open them completely would leave contaminated areas, making subsequent sterilization ineffective. Always remember that for hinged instruments, if it's closed, it's not clean. Question 10. Which government agency is responsible for regulating sterilants and high-level disinfectants used on critical and semi-critical medical devices? A. EPA. B. CDC. C. FDA. D. OSHA. Answer: C. FDA. This question tests your understanding of which regulatory body governs specific types of chemical agents used in healthcare. The keywords regulating sterilants and high-level disinfectants used on medical devices directly point to the Food and Drug Administration, FDA. While the EPA registers disinfectants for environmental surfaces, the FDA is responsible for ensuring the safety and effectiveness of chemical germicides specifically intended for use on medical devices that penetrate sterile tissue or contact mucous membranes. For example, glutaraldehyde and orthothalaldehyde, OPA, used for endoscope reprocessing are regulated by the FDA. Knowing this distinction is essential for proper product selection and compliance. Question 11. Which type of water should be used for the final rinse during manual or mechanical cleaning of instruments to prevent mineral deposits and promote drying? A. Tap water. B. Softened water. C. Purified water, e.g., deionized or distilled. D. Saline solution. Answer: C. Purified water, e.g., deionized or distilled. This question addresses a critical step in the cleaning process that impacts instrument longevity and future sterilization. The keywords final rinse and prevent mineral deposits are important clues. Using purified water, such as deionized or distilled water, for the final rinse prevents the deposition of minerals, like calcium and magnesium, found in tap water, which can leave water spots, create biofilms, or interfere with sterilization. This also helps instruments dry more effectively, preventing corrosion and ensuring they are truly clean before the next processing step. A clean final rinse is crucial for maintaining instrument integrity and effective sterilization. Question 12. What does a Class 1 FDA medical device recall indicate? A. The product is unlikely to cause adverse health consequences. B. The product may cause temporary or reversible adverse health problems. C. There is a reasonable chance the product will cause serious health problems or death. D. The product only needs a software update. Answer: C. There is a reasonable chance the product will cause serious health problems or death. This question assesses your knowledge of FDA medical device recall classifications, which are crucial for patient safety. The keyword Class 1 is the highest level of recall, indicating the most severe potential outcome. A Class 1 recall means there's a strong likelihood that using or being exposed to the product will cause serious adverse health consequences or death, necessitating immediate action by healthcare facilities to remove the device from use. For example, if a faulty surgical instrument could lead to patient injury, it would be a Class 1 recall. Always take Class 1 recalls with the utmost seriousness, as they represent the highest risk. Question 13. Which organization performs on-site surveys of healthcare organizations to evaluate their compliance with standards and can impact their accreditation status, including eligibility for Medicare and Medicaid payments? A. AAMI. B. CDC. C. The Joint Commission. D. WHO. Answer: C. The Joint Commission. This question focuses on a key accrediting body in healthcare. The keywords on-site surveys, accreditation status, and Medicare and Medicaid payments are strong indicators for the Joint Commission, TJC. TJC is an independent, nonprofit organization that accredits and certifies healthcare organizations and programs in the United States, evaluating them against rigorous standards to ensure quality and patient safety. Losing TJC accreditation can have significant financial consequences for a facility. Therefore, compliance with their standards is paramount in central service. Question 14. When packaging instruments for sterilization, why must all hinged instruments be opened or unlocked? A. To allow for easier inventory counting. B. To prevent the instruments from rusting. C. To allow the sterilant to contact all surfaces. D. To make the package lighter for transport. Answer: C. To allow the sterilant to contact all surfaces. This question highlights a fundamental principle of instrument preparation for sterilization. The keyword hinged instruments and the concept of sterilant contact are critical. Sterilants, whether steam or chemical, must be able to reach every surface of an instrument to effectively kill microorganisms. If hinged instruments like scissors or forceps are left closed, the inner surfaces of the box lock and jaws will not be exposed to the sterilant, resulting in an unsterile product. Proper opening ensures thorough sterilization. Always remember, if the sterilant can't reach it, it can't kill it. Question 15. The term decontamination as defined by OSHA for central service technicians refers to A. The process of preparing instruments for patient use. B. The use of physical or chemical means to remove, inactivate, or destroy blood-borne pathogens on a surface or item. C. The final sterilization process. D. The drying of instruments after washing. Answer: B. The use of physical or chemical means to remove, inactivate, or destroy blood-borne pathogens on a surface or item. This question tests your understanding of a precise definition, specifically as interpreted by OSHA, which regulates workplace safety. The keyword decontamination in the context of OSHA points to its focus on rendering items safe for handling by employees. Decontamination aims to reduce the risk of transmission of infectious particles, making instruments safe for subsequent handling, often achieved through cleaning followed by disinfection. This is distinct from sterilization, which aims for the complete elimination of all microorganisms. OSHA defines this to ensure the safety of those handling contaminated items. Question 16. What is the primary function of an enzymatic cleaner used in the decontamination process? A. To harden organic material on instruments. B. To dissolve mineral deposits. C. To break down proteins, fats, and carbohydrates found on instruments. D. To disinfect instruments instantly. Answer: C. To break down proteins, fats, and carbohydrates found on instruments. This question assesses your knowledge of cleaning agents used in sterile processing. The keyword enzymatic cleaner highlights its specific action. These cleaners contain enzymes, like proteases, lipases, and amylases, that are biological catalysts designed to break down organic soils such as blood, tissue, and fats into smaller, more soluble particles that are easier to rinse away. They are particularly effective for pre-soaking and initial cleaning, as they help to loosen and remove bioburden before manual or mechanical washing. Think of enzymes as tiny, digestive agents for organic matter on instruments. Question 17. The Environmental Protection Agency, EPA, is responsible for regulating A. Medical device classification and recalls. B. Sterilants and high-level disinfectants for medical devices. C. Pesticides and disinfectants used on environmental surfaces. D. Worker safety in healthcare facilities. Answer: C. Pesticides and disinfectants used on environmental surfaces. This question clarifies the specific regulatory scope of the EPA in the context of central service. The keywords regulating and environmental surfaces or pesticides distinguish the EPA's role. The EPA registers and regulates products that make pesticidal claims, including disinfectants used for general environmental cleaning, e.g., floors, walls, and non-critical surfaces, to ensure public and environmental safety. This is distinct from the FDA, which regulates sterilants and high-level disinfectants used on medical devices themselves. Remember, EPA deals with disinfectants for the environment, while FDA deals with disinfectants for medical devices. Question 18. Why is it important to keep instruments moist after use and during transport to the decontamination area? A. To prevent blood and tissue from drying onto the instrument surfaces. B. To make them easier to count. C. To improve visibility of contaminants. D. To reduce the weight of the instrument sets. Answer: A. To prevent blood and tissue from drying onto the instrument surfaces. This question highlights a critical step in the care of instruments immediately after use. The keyword moist and the phrase drying onto the instrument surfaces are key clues. Allowing blood and tissue to dry on instruments makes them significantly harder to clean later, as dried bioburden adheres stubbornly and can even bake on during subsequent processing. Keeping instruments moist, typically with a damp towel or enzymatic spray, helps to loosen and prevent organic material from hardening, thus facilitating effective cleaning and reducing potential instrument damage. Proper pre-cleaning care ensures a more efficient and effective decontamination process. Question 19. What does the acronym SUD refer to in the context of sterile processing? A. Sterile Utility Department. B. Single-use device. C. Surgical unit disinfectant. D. System upgrade documentation. Answer: B. Single-use device. This question tests your familiarity with common acronyms used in sterile processing, which are essential for clear communication and compliance. The acronym SUD specifically stands for single-use device. These are medical devices designed and labeled by the manufacturer for use on one patient during a single procedure and then intended to be discarded, never reprocessed or reused. Understanding this term is crucial because the reprocessing of SUDs is heavily regulated by the FDA to ensure patient safety. Question 20. Which agency is responsible for the MedWatch program, which allows healthcare professionals to report serious problems with medical products, including device malfunctions? A. CDC. B. FDA. C. OSHA. D. DOT. Answer: B. FDA. This question assesses your knowledge of critical reporting systems in healthcare. The keyword MedWatch program and its purpose of reporting medical product problems or device malfunctions directly relate to the Food and Drug Administration, FDA. The MedWatch program is the FDA's safety information and adverse event reporting program, designed to gather data on adverse events and quality problems associated with medical products, including devices, to help identify potential safety issues and ensure device safety and efficacy. Reporting through MedWatch contributes directly to patient safety. Question 21. What is the main characteristic of a voluntary standard in healthcare, as opposed to a regulation? A. It is a legally binding law enforced by a government agency. B. It is a guideline or recommendation for best practices, often developed by professional organizations. C. It dictates the pricing of medical equipment. D. It is optional and has no impact on patient care quality. Answer: B. It is a guideline or recommendation for best practices, often developed by professional organizations. This question differentiates between two important concepts in healthcare compliance. The keyword voluntary standard contrasts with regulation and indicates a non-mandatory guideline. Voluntary standards are typically developed by industry groups, professional associations, like AAMI or AORN, or nonprofit organizations to provide recommendations for achieving optimal quality and safety in specific areas. While not legally enforced, healthcare facilities often adopt these standards as best practices to enhance patient care and operational excellence, and noncompliance may still lead to issues with accreditation bodies. Question 22. Which type of disinfectant is effective against vegetative bacteria, fungi, and mycobacterium, like TB, but is generally ineffective against bacterial spores and some viruses? A. Glutaraldehyde. B. Orthothalaldehyde, OPA. C. Phenolics. D. Hydrogen peroxide, concentrated solutions. Answer: C. Phenolics. This question tests your specific knowledge of disinfectant properties and efficacy. The description effective against vegetative bacteria, fungi, and mycobacterium, like TB, but ineffective against bacterial spores and some viruses, perfectly describes phenolic disinfectants. Phenolics are commonly used for environmental surface disinfection in healthcare settings, but they are not considered high-level disinfectants or sterilants because they cannot reliably kill bacterial spores. Understanding the limitations of different disinfectant types is crucial for selecting the appropriate agent for a given application to ensure effective infection control. Question 23. What is the primary role of friction, e.g., scrubbing, in the manual cleaning process of medical instruments? A. To polish the instrument surface. B. To generate heat for disinfection. C. To physically remove loosened soil and debris from the instrument surface. D. To apply the cleaning solution evenly. Answer: C. To physically remove loosened soil and debris from the instrument surface. This question emphasizes a fundamental principle of effective cleaning. The keyword friction and the context of manual cleaning point to the mechanical action involved. Friction, or scrubbing, is essential because it provides the physical force needed to dislodge and remove bioburden, blood, tissue, etc., and other contaminants from instrument surfaces. Without this mechanical action, cleaning solutions alone may not be able to penetrate and lift stubborn soil, leaving residual debris that can impede subsequent sterilization. Think of it like scrubbing a pot. The soap helps, but the physical scrubbing action is what truly removes the stuck-on food. Question 24. How often does the Joint Commission typically conduct on-site surveys of healthcare organizations to evaluate their compliance with standards? A. Annually. B. Every 6 months. C. At least every 3 years. D. Only if a complaint is filed. Answer: C. At least every 3 years. This question tests your knowledge of the frequency of accreditation surveys by a major healthcare oversight body. The keyword how often and reference to the Joint Commission point to their standard survey cycle. The Joint Commission generally conducts unannounced on-site surveys of accredited healthcare organizations at least every 3 years, though certain circumstances can trigger more frequent visits. These surveys are comprehensive evaluations of a facility's compliance with established standards, ensuring continuous quality improvement and patient safety. Knowing this timeframe helps facilities prepare for ongoing compliance. Question 25. Which of the following is an example of an engineering control designed to reduce employee exposure to bloodborne pathogens in the decontamination area? A. Wearing puncture-resistant gloves. B. Proper handwashing. C. Using an automated endoscope reprocessor. D. Providing hepatitis B vaccinations. Answer: C. Using an automated endoscope reprocessor. This question differentiates between various types of safety controls. The keyword engineering control refers to physical modifications to the work environment or equipment that reduce exposure to hazards, rather than relying on worker behavior. An automated endoscope reprocessor, AER, is an engineering control because it contains hazardous chemicals and contaminated scopes within an enclosed system, minimizing the need for manual handling and reducing the risk of splashes or aerosol exposure to the technician. This is distinct from PPE, like gloves, administrative controls, like handwashing policies, or vaccinations, which are personal protections.